Hello and good afternoon, everyone. Thank you for joining me today to hear about the case study of Rose C., a college student athlete with co-occurring disorders. I'm Susan Cunningham, and I look forward to spending the next 30 minutes or so with you. So this is a quick overview of what we'll be talking about today. We're going to take a look at the description of the assigned population that Rose identifies with. We're then also going to look at a review of what co-occurring disorders are. We'll then hop into the biopsychosocial information for Rose. We'll take a look at the assessment of symptoms and the diagnosis, how we came up with her treatment plan, and a progress review plan for Rose. To better understand Rose, we're going to dive into a description of the population of college student athletes. This is very important for us to understand because it really provides the framework of the phase of life Rose is in right now and the daily stressors that she's dealing with. So it's really important for us to understand the complex pressures placed on a college student athlete. Academic performance is a significant source of stress for most college students. This stress may be further compounded among college athletes based on their need to be successful in the classroom while simultaneously excelling in their respective sport. Most athletes engage in a full course load equivalent to 12 to 15 credits in class time. That could be about 10 to 12 hours a week. In addition to homework and projects, you're talking about 30 to 40 hours a week. Athletes who are on scholarship have to do well in the classroom because they have to maintain grade point averages to be eligible for their scholarship. Then you have athletics, which is the main part of their life, you would think. And practice and competition could be 20 to 30 hours a week. That is what is defined by the governing rules of the NCAA. However, when you speak to college athletes, they will tell you that they spend more than 40 to 50 hours a week focusing on their athletics. When you put those two together, there's very limited time for social life activities such as hanging out with friends or family. So this puts social supports really in the realm of their athletic teams. So being able to have good connections with your teammates and your coaches is really significant to student athletes' success and health. When working with this population, it's important to note that the age range of student athletes is approximately 17 to 25 years old. This is a very crucial time in brain development. It's also important to note and remember throughout our discussion today that each individual is unique. Our brain development is different, and we experience the world in different ways. So, from the onset of puberty through early to mid 20s is where young people explore, adapt, and learn through active engagement with the environment, with relationships, and by trial and error. Individual identities will be shaped and reshaped, social bonds will be forged and reforged. The neural network connection in the frontal lobes continues to grow and strengthen throughout this time. Areas of the brain involved in reward, motivation, and emotion also continue to develop. The ability to reason about abstract concepts continues to develop and get stronger. So, other than during the first 3 years of life, this age range represents the period during which the brain changes most dramatically. Risk-taking behavior often escalates during this stage because of changes in the brain's socio-emotional system that increases reward-seeking chemicals. And this is especially when youth are in front of their peers. So at the conclusion of this developmental stage, one's capacity to make complex decisions, weighing competing alternatives, calculating risks and rewards, to control impulses, becomes significantly stronger. However, will also be dependent on our experiences during this time of brain development. So the changes occurring in the brain networks can also relate in heightened vulnerability in risk-taking, recklessness, and sensation seeking, and make this developmental stage a time in which navigating social situations and mastering strong emotions very challenging. During this time in the brain circuitry associated with decision making, individuals benefit from sufficient support, guidance, and monitoring. But this is often a time when adults will withdraw from the lives of young people, leaving them to navigate difficult situations alone or solely among their peers who are also potentially struggling. So, pro social adults, including ourselves, social workers, or other healthcare providers, or coaches, teachers, mentors, we should be more present in the lives of young adults and help them to develop the positive coping skills that they're going to need throughout their lives. So, now that we have an understanding for the general population of college student athletes, let's take a look at what co occurring disorders are. And the information we're going to look at is from the Substance Abuse and Mental Health Services Administration Treatment Improvement Protocol, which is called the TIP 42. So, what are co occurring disorders? Well, the information we're looking at is from Substance Abuse and Mental Health Services Administration, which is the agency that leads public health efforts to reduce the impact of substance abuse and mental illness on American communities. So, people with substance abuse disorders are more likely than those without substance abuse disorders to have co occurring mental disorders. So, clients with co occurring disorders have one or more mental disorders as well as the substance abuse disorders happening at the same time in their life. Individuals with substance use disorders are more likely to have co occurring mental health disorders than the general population. What's important for us to understand is that there is no wrong door by which people with co occurring disorders can arrive at treatment. So, what does that mean? That means that some individuals may feel that their mental health is at stake, and that's the reason why they seek treatment, while others feel that their substance use disorder is interrupting their life, and that's where they seek the treatment. So, interventions and assessments are tailored to what the client sees as their primary disorder, but then us as individual professionals, we do a thorough assessment and we help to arrive at the priority treatment. So essential services for people with co-occurring disorders should always be centered on the person, so person-centered. They should be trauma-informed. We should look at any trauma that's also in their past history or happening in their lives right now. It should be culturally responsive, taking into consideration the specific culture, ethnic background of the individual. And it should be recovery oriented. We should be trying to get the substance abuse part of the diagnosis and disorder under control and into recovery. And we should also look at it being comprehensive and continually offered across all levels. So just because someone goes into recovery doesn't mean that they don't continue to need support around substance abuse. And just because someone's mental health symptoms are not interrupting their daily life doesn't mean that they don't continue to require support around those. So it's really simultaneously and across all levels. So now we're going to meet our client, Rose C. We're going to look at Rose through the 4 domains of the Bright Minds framework. So the Bright Minds framework by Dr. Amen is going to ensure that we assess and address the needs and build upon strengths in the 4 domains of Rose's life, which include the biological, psychological, social, and spiritual domains of her life. So let's begin to get to know Rose. So Rose C is a 20-year-old biracial Black Italian-American female. Her pronouns are she, her, hers. She's a full-time junior on a partial sports scholarship at a D1 university. Her mother and sister reside about 4 hours away from her college campus. Rose's father passed away when she was in 8th grade, and Rose has played her sport since she was 6 years old. So, to give some more description, Rose was successful in high school sports, but she did not live up to her own expectations across her first year of college. And subsequently, she suffered an injury that ended her season early. So Rose contemplated quitting the college team because she thought her efforts were a wasted time. She recognized, though, that there would be a monetary impact on her education because of the scholarship, and she did not want to let down her coach or her family. So when Rose went to talk to the assistant coach about her thinking about quitting, the coach encouraged her to continue with the sport. So Rose continued with her sport. She didn't quit the team, but she has disclosed that she questions her decision almost every day. So, as far as the social domain of her life, Rose lives on campus in housing reserved for athletes. She does have a close relationship with her mom and sister, but they do not visit often. Rose is struggling with her academics this semester. She looks at her teammates as being better than her. She has a few friends that she says she can talk to. She does have a hard time making new connections, and she did disclose that she will consume alcohol to fit in. In the biological domain of her life, Rose reports no known health problems. She does suffer from chronic back pain and ankle pain related to a prior sports injury. She struggles with insomnia and daytime tiredness. She reports a lack of appetite and admits poor nutrition habits. She does have a parental history of prescription drug misuse and alcohol use, and we'll talk about that when we talk about her assessment tools. So, in regard to psychological domain of her life, Rose reports no prior mental health diagnosis. Currently, she's reporting symptoms of anxiety, negative thinking. She's easily frustrated. She's overly sensitive to criticism. She lacks self-confidence, and she has a preoccupation of fear of re-injury. So Rose was referred for services by her athletic trainer after she was observed to be uncontrollably crying one day after practice. Rose reports that she does not see herself the way other people see her, and she did not think she was good enough to compete in Division I collegiate sports. She believes her performance has suffered from a lack of confidence and motivation, as well as her sports-related injuries, which we've mentioned, which have resulted in her having chronic pain. She describes herself as not depressed, but she's not super happy. She feels that she's emotionally weak. And when her coaches give her corrective feedback, she views it as a personal attack, and this leads to her feeling stressed out about her athletic performance. Although Rose does not admit in frequent drinking during our initial assessment, she did say that she's experienced binge drinking to the point of blacking out, and she will drink to fit in with friends. She also says that she has begun to drink a little bit more frequently, and she's thought about drinking in her room before going to practice or games to reduce her inhibitions and fear of injury, but she's afraid of getting caught and disappointing her coaches. So, in regards to the spiritual domain of her life, Rose was raised as with Catholic religion. She reports that her mom practices regularly. Since coming to college, Rose does not attend church services regularly. She says she does pray to God when she feels lonely or when she misses her dad. But since her dad's death when she was in eighth grade, she questions God's existence sometimes, and she also questions some of the Catholic ideologies and practices that she grew up with. Upon meeting Rose, she was found to be open to answering questions. She was very engaging. She spoke very eloquently. There were times where she answered questions in the form of a question, as if she were seeking approval for her answers. So Rose was administered the online screening to brief intervention, S2BI, and Rose's responses to this placed her at higher risk for use of alcohol, marijuana, and over-the-counter drugs. During our interview around this tool, Rose disclosed family history of alcohol misuse by her mother and prescription drug use by her father. Her father passed away suddenly from a heart attack when she was in middle school, and she reported remembering her mother drinking every day after that time. She did say that her mom has been sober for about 5 years, and mom is not aware about Rose's current drinking. In addition to drinking alcohol at a higher rate than she previously disclosed, Rose also admitted to using over-the-counter pain relievers and sleep aids multiple times a week. So Rose is not currently prescribed medications to manage symptoms of chronic pain. However, due to her responses in the S2BI, Rose was administered the online opioid risk tool, which rated her to be at high risk of misuse of opioids for chronic pain management. So Rose was also administered the GAD-7, the Generalized Anxiety Disorder 7 item, due to her reported high levels of worries and fears. And the GAD-7 results indicated that she is experiencing very high levels of anxiety that make it difficult for her to manage her day-to-day life. Due to Rose's high-risk rating in the S2BI, the OTR, and the GAD-7, it was determined to screen Rose for risk of suicide. Recent study conducted by Dodd et al. Indicates that suicide is the second leading cause of death among college-aged young adults, and specifically among college students. The study also found that student athletes have a higher level of fearlessness of death due to their higher pain tolerance, which results from experiencing either sports-related injury or high level of physical contact in athletics, and puts them at even higher risk of suicide. So the Columbia Suicide Severity Rating Scale was administered for Rose. She was found to not have current indicators of suicide present, but this will be something that, along with her other symptoms, we will continue to assess throughout. So after reviewing the assessment tools, my interview notes, and consultation with the DSM-5, Rose was diagnosed with alcohol use disorder mild in a controlled environment, as she is under age 21 and is residing on campus where access to alcohol should be limited. She was also diagnosed with general anxiety disorder. So when we reviewed the diagnosis with her, Rose expressed disappointment in herself, but she said she was motivated to participate in treatment to decrease her alcohol use and get her anxiety under control. When developing the treatment plan with Rose, it was important to keep in mind her existing daily demands and to keep the objectives connected to her daily life so as to not make them feel like extra burdens for her and increase her anxiety instead of reducing it. With Rose's motivation to work on her identified co-occurring disorders, made her a good candidate for cognitive behavioral therapy, CBT. So CBT is a structured and time-limited intervention which has shown to be successful with college students. And it will provide Rose with useful tools and strategies to identify her triggers and negative thinking and then develop new and healthy habits. So the treatment plan will uses Rose collaboration as a motivating factor to generate changes in her behavior, her beliefs, and her habits that can be self-reinforced by her. So CBT will get Rose actively involved in her treatment so that she can understand what her triggers are, that in a way for her to improve her lives and to adjust her thinking and her approach to everyday situation. So the overall goal of CBT with Rose is symptom reduction, improvement in functioning, and remission of the disorder. So we would like Rose to achieve sobriety and be in recovery with her alcohol use. And we would also like her to decrease her symptoms of anxiety. So taking a multidisciplinary approach inspired by Dr. Amen's Bright Mind framework and the 4 circles, Rose's treatment plan will include her team doctor, athletic nutritionist, and social supports identified by Rose. The Bright Minds framework will ensure that we address needs and build on strengths in the biological, psychological, social, and spiritual domains of Rose's life. The athletic nutritionists will be used to educate Rose on improving her eating and sleeping habits, because literature has shown that student athletes with high nutrition knowledge are more likely to meet nutrition recommendations, therefore promoting optimal nutrition practices. So Rose must have the appropriate knowledge base around her nutrition and health. And then the team doctor will be requested to conduct a physical exam of Rose's previous injuries and assess her chronic pain symptoms. So with this team approach, Rose will be supported by multiple people in the 4 domains of her life, which will minimize her risk factors. Rose will be encouraged to make small incremental changes to her everyday routine, which will relieve anxiety and create lifelong healthier habits. So that's a page straight out of Dr. Amen's book about small incremental changes. Unfortunately, Rose has chosen not to include her mother or sister in her treatment goals at this time. Rose will be encouraged to include them in the future to strengthen their relationship for times when she is at home with her family. The first treatment goal that we developed was Rose will decrease her alcohol use by addressing the behaviors, thoughts, and factors contributing to her use. So to do that, the objectives we laid out were Rose would attend weekly CBT therapy sessions to identify the patterns leading to alcohol use and develop coping skills to reduce that use. We also said that Rose would use her 24/7 peer support line, which is offered by her university, to get extra support when she felt urges to drink. Rose chose not to attend traditional AA meetings, but felt the 24/7 peer support line would give her a good place to go for extra support. We also talked about incorporating the HALT strategy to prevent relapse. So this is something from Dr. Amen. And HALT, as you see down at the bottom, is the H is for do not get too hungry, develop healthy eating habits. Do not get too angry by stopping automatic negative thoughts. Do not get lonely by staying socially connected. And do not get too tired by having healthy habits. So all of these 4 things actually fit into our assessment, and we found a great strategy that Rose can begin to practice. We also talked about Rose replacing alcohol in her dorm room with non-alcoholic beverages and nutritious snack options, which would also lead to her encouraging her to develop healthier eating habits, which is actually in her next goal. Goal number 2, which Rose identified, will be to increase positive social connections to reduce triggers to alcohol use. So this goal is really going to support Rose getting into recovery from alcohol misuse, and also her increase her social connections and give her a bigger social support network, which will not include the use of alcohol and drugs, so for her to achieve recovery. So the three objectives are to participate in school or team events which are alcohol free. So this will increase her social network. Rose also spoke about wanting to begin to attend religious services. So she is going to try to attend services at least once a month to begin to practice her religion and get that spiritual connection. Rose also determined that she could join student organized events that are held in her dorm, which in the past she had not done because she felt like she wouldn't fit in. But these are great ways to get to know other students who live in the dorm that are not athletes, and also she can be part of study groups or team building activities, which she had not done in the past. So Rose is really going to try to actively participate in these objectives to broaden her social support network beyond her athletic team. Goal number 3, identified by Rose, is to develop healthy coping skills to reduce anxiety, increase self-confidence, and enhance her athletic performance. This goal is focusing on Rose's efforts to build healthy habits to promote her physical health, which is very important for her with her athletic performance. Rose expressed that a lot of her anxiety and fear of re-injury was surrounding the nutrition and sleep habits that she had. So we're going to have her meet with the team nutritionist to identify the barriers to healthy eating and sleeping and develop a realistic daily action plan for Rose. Secondly, we're going to set up a time for Rose to meet with a team physician to have an assessment for her chronic pain, and then develop a pain management plan with the team doctor, which may include some physical therapy, some extra exercising, and if necessary, pharmacological interventions, although Rose would prefer not to have to take any medications at this time. We then determined that once the plans with the nutritionist and the team physician were developed, we would incorporate the objectives from those plans into our CBT session so that we can offer Rose some extra support in building up her coping mechanisms and strategies to maintain a healthy balance in her life to support her physical health. And lastly, as part of our treatment plan, we're going to have a progress review plan. So Rose, in sessions with me, we will review her goals and objectives and see where she stands. If there's barriers to progress, then we're going to look at what those barriers are, what's happening, and why are these barriers in existence, and what are alternatives? Did we choose the wrong objective? Are the action steps not doable? And so what are things that we can put into place that would take down these barriers and so as not to discourage Rose from continuing in her treatment? We then will talk about having a 90-day team meeting held with the nutritionist and the team doctor. And when Rose is ready, include her mom, her sister, or any other social supports that she would like to have present, so we can discuss her overall progress and determine where the next steps are, what Rose continues to need interventions with, and also give her positive reinforcement for the things that are going well, for those small incremental steps that she's taking. It's going to be very important for Rose to receive support from not only her peers, but also from her coaches, the athletic trainer, the nutritionist, from myself, and when she's ready, from her family, for her to be able to build lifelong habits that will support her recovery and healthy living. So at this time, I'll take any questions and feedback. And if there are no questions, I want to thank you for your time listening to the case study of Rose C.